Hello, hi and namaskara. My name is Kirtan and I am a second year medical student studying in a government medical college. Today I will be talking about the topic cardiac cycle. This is the first part of this topic. I will upload the next part in the coming days. I know many of the students fear from this topic, but I don't know the reason why. Today I will be making this topic easier. This topic can be asked as a 10 markers or as 5 markers in the examination. So they may ask what is cardiac cycle, explain the steps, and they also ask the main question, that is explain JVP or jugular venous pressure. We will also be talking about that in this video. So let's start. What is cardiac cycle? It is defined as the sequence of events, that is electrical and mechanical events occurring in the heart during a single beat. So the heart normally beats 75 times per minute. So how much will a beat be? How much seconds will a beat be? It will be 0.8 second. So a cardiac cycle takes place for 0.8 second. This cardiac cycle consists of arterial systole and diastole and ventricle systole and diastole. You have studied in your class 11 standard that in the heart the blood comes in the right atrium, then to the right ventricle, then it goes to the lungs to get oxygenated, then it again comes back to the left atrium and then to the left ventricle and then it goes to the body. So actually this does not take place in order. It takes place simultaneously, like the arteria contracts simultaneously and the ventricles contract simultaneously. So the arteria contracts first and when the ventricles will be relaxing, while when the ventricles contract, the arteria will be relaxing. So the contraction is called the systole and the relaxing is called the diastole. So now let's talk about the arterial systole. So we'll only be talking about the left side of the heart because it is more studied. So let's start. The first one is the arterial systole. During this period, the blood flow from the arteria enters the ventricle due to the arterial contraction. So it contributes to less than 20% of the filling of the ventricle. So the arterial systole, in this the arteria contracts, due to which the blood from the arteria enters the ventricle. But this only less than 20% of the filling of ventricle happens due to this. So what is the reason? So most of the filling of the ventricle happens in the arterial diastole, or when the arteria is relaxing. It occurs passively. So therefore 80% occurs passively. But when there is tachycardia, that is when you do exercise, the diastolic duration will be compensated. So the diastolic duration will be reduced and therefore the heart will mainly depend on this arterial systole. So then the arterial systole is very helpful. So in that situation, 30 to 40% of the filling occurs. So it occurs in tachycardia. So this is an important point and clinical significance also. So what are the major events which takes place in the arterial systole? The arterial systole begins from the peak of P wave, which we have studied in the ECG video, and it ends with the peak of the QRS complex. The ventricular volume increases mildly. So why does this increase? Due to the arterial systole, the blood comes from the artery to the ventricle. Mildly, because only 20% of the filling occurs. The arterial pressure rises, that causes genesis of A wave in the arterial or jugular venous pressure curve. So this JVP curve we will be talking later in this video. Just remember that the A wave occurs in the arterial systole. The arterial pressure exceeds the ventricular pressure because the artery is contracting here. The fourth heart sound is heard. It is recorded through a device called as phonocardiogram. Phonocardiogram. So the fourth heart sound is recorded. It is produced by the inrush of blood into the ventricle. The end of the arterial systole is represented by the closure of the mitral valve. So after the blood, the 20% filling occurs, there is closure of the mitral valve and then the arterial systole ends. Now let's talk about the arterial diastole. The arterial filling occurs in this phase. It occurs during the ventricle systole itself. So therefore the arterial diastole is not much mentioned anywhere. At the beginning of the ventricle systole, the bulging of AV valve into the atrium results in increase in the arterial pressure. That reproduces the C wave in the JVP. So the A wave is produced, so here we can see that the A wave is produced due to the arterial pressure is increased due to the arterial systole, whereas the C wave is produced due to the bulging of the AV valve into the atrium. The atrial pressure is also increased due to the increase in the atrial volume. So in the atrial diastole, the atrial filling occurs, so therefore the volume of the atrium increases. So when the volume increases, the pressure also increases. So this produces the V wave in the jugular venous pressure curve. So now let's talk about the ventricular systole. This ventricular systole is again divided into two phases. The phase of isovolumetric contraction and the phase of ventricular rejection. So let's talk about this now. So now let's talk about the phase of the isovolumetric contraction. So what are the major events in this? There is the appearance of the QRS complex that signifies this phase. The first heart sound is heard or appears in this phase. The first sound appears due to the closure of the mitral valves. Closure of mitral valves. The ventricle pressure rises in the left ventricle from 0 to 80 mmHg and in the right ventricle from 0 to 8 mmHg. In the left ventricle, the pressure increases more because the mass of the muscle of the left ventricle is more than the right ventricle. The valves of the heart remains completely closed. So all the valves are closed in this phase of contraction. So therefore it's isovolumetric contraction because there is no exchange of blood in the ventricles or the arteria. The ventricular volume does not change and the aortic blood flow is also nil. This is due to that all the valves of the heart are remain closed. It starts with the closure of the mitral valve and ends with the opening of the aortic wall. So the opening of the aortic wall marks the end of this phase of isovolumetric contraction. So here you should remember that you should not only by heart these phases or the major steps happening in this phase. You should also understand the phase. If you understand it better, you can get it better in your examination. So here the phase of ventricular rejection. It is of two types, rapid rejection and the reduced rejection. Rapid ejection comes first and the reduced ejection comes later. So we'll write the steps of the rapid ejection just by understanding it, not by hearting it. So what and all can happen in the rapid ejection phase? So there is, let's understand this. There is increase in the blood flow, aortic blood flow. So why does this happen? Because when the blood is stored in the isovolumetric contraction, there is the creation of the potential energy. Due to this increased potential energy, when there is sudden opening of the aortic wall, there will be rapid ejection and therefore the increase in the aortic blood flow will increase drastically. So there will be steep increase in the aortic blood flow. So this phase actually starts by the opening of aortic wall. So it starts with opening of aortic wall. So this is the basic point. If you forget also, you can just remember what and all happens, understand it and write it in the exam. So what happens next? Due to the increase in the aortic blood flow, the blood will go from the ventricle to the aorta. So therefore, there will be fall in the ventricular volume. Fall in ventricular volume because the blood is going to the aorta. So the aortic pressure is increased because the blood comes there, but it does not increase more than the ventricle. The atrial pressure initially decreases. It initially decreases because when the ventricles are contracting, the atria will relax. So therefore, initially the atrial pressure will be decreased initially, but after some time it will increase because of the filling of the atria. So the filling of the atria takes place here. So the next point you can write by remembering is the C wave occurs in this phase. C wave of JVP occurs here. This phase represents the ST segment, of the ECG. Okay. So there is also increase in the aortic pressure. I told about it, but I did not write it. There is increase in the aortic pressure also, but not more than the ventricular pressure. Okay. So now let's study about the reduced ejection. The aortic and the ventricular pressure decreases, but the aortic pressure is more than the ventricular pressure. So why does this pressure decreases? Because the aortic blood flow is decreased. So the ventricular blood is decreased, so therefore the aortic blood flow will also decrease, since most of the blood is already transported through the body. So what is the second point? So what about the ventricular volume? The ventricular volume is reduced. So can you correlate that the ventricular volume, most of the blood has gone, so therefore the ventricular volume has greatly reduced or decreased. The aortic blood flow is also decreased. Aortic blood flow is also decreased. The atrial pressure also increases because of the blood which comes to the atria. Due to the ventricle systole, there will be arterial relaxation. So therefore the atrial pressure will be increased. So what happens next? The T wave is seen in this phase. So the T wave of ECG is seen in this phase. So how does this phase terminate? It terminates by the closure of the aortic valve. So the aortic valve is finally closed in the end of this phase. So this is how you can understand and correlate, and therefore you can write in the examination easily instead of biting it. So next comes the ventricular diastole. So in the ventricular diastole is again divided into two parts, that is isovolumetry relaxation, the same as the isovolumetric contraction, only relaxation is different. The next one is the ventricular filling. It is also again divided into rapid filling phase and reduced filling phase. So in the isovolumetric relaxation, there will be rapid fall in the ventricular pressure. So there will be no change in the ventricular volume. The aortic blood flow is nil. The second heart sound is heard. The second heart sound is heard due to the closure of the aortic valve. The peak of V wave of GVP occurs here, and it ends with the opening of the mitral valve. So the mitral valve opens in the ending of this isovolumetric relaxation phase. So now let's talk about the rapid filling phase. There is a rapid increase in the ventricular volume. So because of the filling of the ventricle. So there is decrease in the atrial pressure and also the ventricular pressure. So decrease in atrial pressure is due to the atrial blood will come to the ventricle. So that the atrial volume will decrease, and therefore the pressure will also decrease. The ventricular pressure will decrease because of there is relaxation of the ventricular muscle. The third heart sound appears. It also starts with the opening of the mitral valve. The next one is the diastasis, or that is nothing but the reduced filling phase. So in the diastasis, there is slow rise in the ventricular volume. There is no change in the left atrial, ventricular and aortic pressures. So no much pressure change is seen in this phase. The ventricular filling mostly occurs due to the passive filling, that is 80%, and 20% filling is occurs due to the atrial systole. So writing in the flow chart, the atrial systole, then the isovolumetric contraction, then happens the ejection, then happens the isovolumetric relaxation, then the filling, and then again the arterial systole, so that the cycle circulates and continuously repeats. So next comes the jugular venous pulse, that is the JVP. It is the record of the pressure change in the internal jugular veins of the right side of the neck. So why should we record the pressure change in the internal jugular veins of the right side of the neck? Because by recording the pressure of these veins, we can easily determine the atrial pressure changes, because these both are similar. So by recording the pressure along the internal jugular veins of the right side of the neck, we can indirectly measure the arterial pressure changes. So this is the graph of the JVP, that is nothing but the jugular venous pulse pressure wave. So the waves as the JVP are the A wave. The A wave happens due to the atrial contraction. So when does this happen? This happens during the atrial systole phase. So A, so therefore atrial contraction. Then comes the C wave. It occurs to the bulging of the AV valve into the right atrium, So therefore the C wave is seen. This is the C wave. So you can remember is that the bulging of the AV valve will look like this into the right atrium. So this is inverted C. So you can remember like that. The next one is the V wave. It occurs due to the venous filling of the atrium. So there are two descents also, that are the X descent and the Y descent. So why does this X descent happen? It happens due to the fall of the right atrial pressure due to the relaxation of the right atrium. So therefore, fall of right atrial pressure due to the relaxation of right atrium. So why doesn't happen? It happens due to the fall in right atrial pressure when the blood enters into the right ventricle. So when the ventricular filling happens, the fall in atrial blood pressure happens. So therefore there is the Y descent. So what are the abnormalities seen in the JVP waves? So this is an important condition to remember. This can be asked in the examination also, like what can be seen in the abnormal JVP waves? In what condition can it be seen? It can be also asked in the Viva. So the condition of the raised JVP are the right-sided heart failure, the obstruction of SVC, that is nothing but the superior vena cava, the congestive heart failure. So only 3 you can remember. The next one is the Cannon wave. The amplitude of the A wave is abnormally big in this case, and it is also called as the J wave, giant A wave, or the Cannon wave. It happens in conditions like complete heart block, nodal rhythm, when the atrium and ventricle are activated simultaneously. So this is the cardiac cycle and the JVP wave. So I hope you have completely understood this video and will never forget it. If you have found this video informative, please like, share and comment, and also don't forget to subscribe. I'll provide the notes link, that is the Telegram link, in the description and also in the comment section. You can see it for better understanding. Thank you.